So thanks very much for inviting me to be here, and my thanks to all of you for being here in DC, because as you heard from Katie, we're living in this very fiscally sort of chaotic time, and there's a lot of craziness going on here in DC, which could ultimately impact funding for medical research, which is what I'm going to be talking about. How many of you have heard of ResearchAmerica before? Oh, great, so a few of you have. For those who haven't, we are a member-based nonprofit organization, and our members are institutions, and you can see they sort of comprise the spectrum of stakeholders in medical research. So that can be patient groups, it can be research universities, independent research institutes, industry, folks coming from hospitals, as well as scientific societies. So very broad spectrum. We have about 400 members of ResearchAmerica. And our mission is to make health research a higher priority, and what that actually means is advocating for all of the budgets of the agencies you see in front of you here today. So I'll get into more detail about NIH on the next slide. The NSF is a very important federal agency. They fund about 85% of all of the non-biomedical research in the United States, so very important agency. I'll let Steve talk about the FDA. How many of you all have heard of AHRQ, the Agency for Healthcare Research and Quality? So, yeah, relatively small portion of you. They do comparative effectiveness research, also important in actually bringing research into practice, which is a really critical service. And I'm going to skip the CDC because I think most of us are aware of what CDC does. And at ResearchAmerica, we're probably best known for our work around the NIH budget. If you look at the NIH budget and you start from 1999 through 2003, that was the period of the NIH budget doubling. This is probably what we're best known for at ResearchAmerica. We played a leading role in making this possible. And in doing this, we worked with Congressman John Porter, who was chairing the subcommittee that sets funding for NIH and for CDC and for AHRQ, and he now chairs our board at ResearchAmerica. And if you look further down to 2009, you see the Recovery Act. That's that big red line. That was $10 billion for NIH over a 2-year period. And again, this is another area that we played a leading role in, along with others in the medical research community. But since then, it's really important to point out that over the past 10 years, the NIH budget has basically stagnated. In fact, the NIH has lost about 20% of its purchasing power over the last decade. So really significant challenges there, and what that means is the institute itself has about the lowest historical funding rates for researchers that it's ever faced, and what that means is we have a lot of young scientists and young researchers unable to get their research funded, and they're actually leaving science altogether. And so all of this is happening at a time when we are really, we have these amazing breakthroughs that are happening almost daily for science and for research. I wanted to show you this one example. How many of you guys saw this article last week in the Times? Oh, so only a couple of you did. This article is about whole genome sequencing and about the potential impact on rare diseases and disorders. And this technique, whole genome sequencing, is something that probably would not exist if it were not for the federal government's role in investing in research, in particular the Human Genome Project, which was a multi-billion, multi-year effort that really has allowed this technology to come to fruition. And now it's finally getting to the point where we're starting to see it help patients and have a real impact. And this is just the beginning. This is what's at risk from things like sequestration. In addition to that, I wanted to talk about another kind of big issue du jour, which is the cost of healthcare in this country. So what this chart is showing you is the cost of various chronic diseases. If you look all the way on the right, you see Alzheimer's at about $200 billion per year. That's a staggering cost. And if you look, the blue lines, which are intentionally hard to see, that's how much the NIH is investing in curing this particular disease. So you can see that the cost of healthcare is greatly dwarfing what we're spending on research. I mean, when I look at this, it just shows how far off we are from the mark in this country in terms of how underinvested we are in research. This is probably better said by Mary Lasker, so I'll leave you with this quote from her. So in response to these issues, and of course sequestration, which is now barreling down on us, ResearchAmerica put out this report on sequestration. We've had to update it several times because the numbers keep changing, but this is what we have out today. Here's what's at stake. So you can see this is what the NIH would lose in the first fiscal year alone. So NIH would lose over $1.5 billion in just the first fiscal year of sequestration. So you can see the other agencies up there, and we're looking in total, if you add them all up, over $2 billion lost in the first year. So very serious consequences from sequestration. In terms of what this could potentially mean for rare diseases, I don't think that's known exactly just yet. What is known is that if you go on the NIH website and look at their own estimate of what they are spending on rare disease research, NIH estimates that they spend $3.5 billion per year investigating rare disease-related research. So if you take that number and subtract what sequestration could do, that could mean NIH would lose $180 million from that total, that amount of money. So that's a huge amount of ground that we would lose in terms of research for rare diseases. And in response to all of this, we launched a national campaign along with dozens of other groups, which came to be known as the Save Research campaign. And this image you see before you is really the sort of flagship of the ad campaign that we ran inside the Beltway. We're trying to get Congress to understand that this is not just a 5 or 10% cut, which sounds kind of innocuous at first. This is something that's going to have real implications for researchers and ultimately for patients. So, you know, we really pulled out all the stops, and we wanted to do something edgy to really get the message across to Congress. And obviously, we still have sequestration, but if you all remember the fiscal deal, sequestration was not dismantled as we would have hoped, but it was at least pushed back, and here we are today, still facing sequestration, unfortunately. I did want to share the mantra that we sort of came up with for this campaign, which is we need cures, not cuts. And this was really helpful for us to have, because when you have dozens of groups that are all sort of coalescing, it really helps to have one common message, because every group has, you know, their own nuanced way of talking about these issues, but this was one we could all agree on. So you all are already here in DC to talk about funding for research and related issues, which is great. Your timing could not be better. And you all are already engaged, so that's a great first step. There's lots of ways to get in touch with congressional offices. In terms of which ways have the most impact, I would argue that the more time you put into engaging with the office, the more impact it's going to have. So you can send a sort of form letter, a tweet, or send an email, but actually going to the district or coming to DC to have an in-person meeting, I'd still say is probably the best way to sort of have an optimal impact here in Washington. Aside from that, it's very important to be engaging the media in all of this. I'm sure you all have seen all of the stories about sequestration that are going on. Any story about sequestration that mentions health or medical research, that's an opportunity to write an op-ed or a letter to the editor responding to that issue. I mean, the public opinion is very heavily sort of molded by what's going on in the media, but policymakers are also reading this stuff every day. So if you can get it in there, you're really getting a sort of double win. Lastly, if you folks represent organizations, you should join ResearchAmerica. All of the information is available online on our website. As I mentioned before, we have over 400 members, and we are literally working every day to stop sequestration and make sure that funding for NIH, for FDA, for all the agencies involved in health research is as high of a possible priority as we can make it in this country. So. One sort of last slide I wanted to leave you all with. I know you guys are going to be on the Hill tomorrow, so the Hill meetings that I've been to recently, they can kind of go one of two ways. Sometimes you go into an office and they basically just agree with everything you say, and you're like, that's great. But then there's the other occasion where you go into an office and you might get some pushback when you say we should be investing more in NIH or medical research, for example, and they might say, well, when our country is running historical deficits that have never been higher, why should we be spending more on any program? They might say, well, that's great, yeah, we should increase NIH, but you know, what should we cut in order to make that increase possible? So this is the kind of pushback that you may experience tomorrow. What I would call these are these sort of rhetorical traps that are best avoided. This is stuff that's going to take you off your message. I mean, you all are on the Hill, and you're there to be talking about rare diseases. This is what your expertise is in, and I think this is, you know, what you should be talking about tomorrow. I think all of us have opinions about taxation, about defense spending, about education, about any number of issues, but really, you know, you should stick to what you know and stick to your message. Lastly, I want to point out that cutting medical research is not a deficit reduction strategy, and that's for two reasons. One is, as I showed you in that last graph, medical research can actually prevent and cure disease, and that is a huge part of getting our healthcare costs under control in this country. Not only that, but we know investing in medical research is a proven job creator. So you can look at industries like biotech that, you know, very much draw on publicly funded research to make their work possible. So, you know, those are two reasons right there why you could cut all of the NIH budget, which is actually less than 1% of the total federal budget, and still not make a discernible impact on the deficit issue. And you've heard this like 10 times today, but I'm going to say it again. It's really all about following up and building a relationship with that office. I think that's all I'm going to say on that. With that, thanks so much for listening.